Good afternoon. My name is Mihiraa Robin. Can you say your name for the record, please? Good afternoon. My name is Elsa Donald. And what's your candidate number, please? My candidate number is 27050244641. Thank you. And you are taking this test as a nurse, is that correct? Correct. Thank you. Can I see your ID, please? Sure. Here it is. The warm-up questions are not assessed as a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. What do you feel you contribute to your patients? I provide all of my patients with the very best care and advocacy that I can. It's important for me to ensure that my patients are always comfortable and are confident in my abilities, so they know they are being looked after properly. Also, I will act as their advocate if necessary, and give a voice to any concerns they may have about their treatment. What does compassionate care mean to you? I am a naturally compassionate and caring person, as I think that it is difficult to learn these character traits. I treat patients how I would want to be treated. Being kind when listening to patients and addressing their problems is one way to show compassion. Describe how clinical rotation prepared you for a career in nursing. I learned a great deal of invaluable information at my school. Rotations taught me intangible skills, such as bedside manner, by providing me with practical experience of dealing with patients. In your opinion, what are the best and worst aspects of nursing? In my opinion, one of the best things about being a nurse is helping a patient to get to good health after they have received the highest standard of care. The hardest thing is where a patient continues to suffer from pain, despite all interventions. Describe a time when you did not get on with your team member and how you resolved it. I used to have many disagreements with another nurse in the ward. Our personalities seemed to clash and there were arguments about nearly everything. I decided that this was not good for the work environment and invited her to lunch one day. We addressed our differences and began to communicate and get along much better. Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions? No. You have up to 3 minutes to prepare the first role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes. Thank you. You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please? Hi, good morning, I'm Elsa Donald, the head nurse in charge. For my confirmation, shall I know your name, please? Good morning, nurse. You can call me Mihiraa Robin. Hi Mihiraa, I'm here to observe your current situation. How are you today? Well, I'm good. But, not fully recovered. I feel something wrong with me. No worries. It will be all right. If you don't mind, may I know what you feel exactly? Well, I'm having difficulty while swallowing and speaking. I can see you're strained to speak. However, I need to have better knowledge about your current situation. So, may I ask you a few questions, please? Sure. My only concern is to do something to get me better soon. How you feel while having breakfast today? I feel pain. It was difficult for me to swallow. What did you have in your breakfast today? I had soup and 1 glass of milk. Even the liquid food causes me pain. Okay. In 0 to 10, how will you rate the pain while swallowing? 9. I was in a lot of pain and I could take only a little amount of food. Alright. May I know how you rate your pain while talking in 0 to 10, please? 8. I control my sound and avoid talking much. But it's like throbbing pain, and I get irritated as well. I'm sorry to hear that. Unfortunately, pain is usual after the thyroid surgery. It will be resolved after taking a set of antibiotics. The major reason for pain is because of surgical wounds and swelling existing in your throat. But don't worry, it will be resolved over time. However, I advise you to take softer foods and liquids initially, if you have a sore throat. Advance your diet as you see fit. Alright. May I know, do you have anything else to mention other than this pain? Well, I'm having difficulty when I breathe. I'm really unhappy due to this situation. May I know the reason for the uneasy breathing pattern? Please, do not get upset with your current situation. These breathing difficulties are quite normal. 97% of the patients will be suffering these initially after thyroid surgery. There is nothing to be alarmed about. Anyways, for more clarification, I can inform your consulting doctor regarding these symptoms. Well, thank you. I am unable to bear these troubles. For my clarification, may I know how long these will last? I certainly acknowledge your worries. I assure you that this pain and breathing trouble will fade away completely in 2 to 3 weeks. And you will be perfectly alright. Will there be a problem for me in the future? Not really. There will be no problem as long as you take care of yourself and follow all the instructions as per the doctor. Nurse, will there be any effect or a change in my voice? There will be some changes, as this operation was one of the complex ones. But, I suggest you do not worry, as there would not be a sort of problem for you in the future. I am really worried, because being the mother of 2 school-going children, I can't just sit idle. I certainly understand your problem, but you see, you will have to take great care of yourself. I would recommend you to take 2 weeks complete rest. Okay. Definitely I will. Miss Michonne, kindly make sure not to pressurize your vocal cord too much by speaking loud and continuously. Instead of that, you can use a paper and pen to convey your ideas. In hospitals, we can provide you with a specialized electronic device where all your requirements are arranged on the home screen, so you just need to call a nurse by use of a call bell and convey your need by choosing from it. Okay. That's great. I will take care of it, nurse. Just remember, if you can follow what is prescribed for you, then, certainly you will be able to lead your normal life very fastly. Yes, I will, nurse. Definitely I can. Okay, then I will catch up with you again. Take care. Thank you, nurse. If you need any attention, please ring the bell button on your left side. We will be here for your help. Yes, thanks for your support. Get well soon. Take a rest.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.